I've built Synapse, which is an intelligent patient safety software. Or you can basically in clinical care, patient data is very messy and it lives in handwritten notes, rushed voice updates from nurses, and fast text entries in the chart. When these sources disagree with each other, clinicians may not catch it in time, and that's how medical errors happen. I've built Synapse specifically to prevent that, and using the advanced multimodal reasoning of Gemini 3 Pro. You can add notes. You can add it as a source. You can add pictures of prescriptions. Or you specifically mentioned that to stop heparin. The OCR extraction is done entirely by Gemini 3 Pro. And lastly, you can add record a voice handoff or drop in audio files. You have got a nurse handoff recording. Again, the transcription is done by Gemini 3 Pro. And over here, it's shown that heparin drip is recommended. So there's clearly a disagreement between the nurse and the doctor. So when I click analyze handoff, the Gemini doesn't just generate stuff. It accordingly reasons all the data and forms the case analysis. I've got the case analysis over here. You can save the many kinds of the cases which are there. I'll just go along with the features over here. You can save it in PDF and the JSON format. You can read out loud, as you can see over here. It shows the critical conflicts which are detected, such as the medical administration conflict that the heparin drip is currently running despite cardiology order to stop. This is directly a conflict which I had mentioned before. Over here, you can see the sources of where it comes from. That is the plan to stop heparin. And the second source, which shows that heparin must be started, which is from the nurse handoff. You can even dismiss these conflicts and maybe edit these conflicts based upon various conditions. You can show the resolution with the source. You can also update the reason. You can add various kinds of notes. You can maybe restore them again. Apart from that, it also shows the missing information such as the allergies, the active medication, the vital trends, code status. And it provides a patient timeline so as to when each of the things or each of the timeline pointers were mentioned. So such as like at 8:30 a.m. the patient was admitted to ICU and heparin drip was started as per protocol. Apart from that, you can see the history log over here of all the things which I did. That is analyze, adding the sources, etc., etc. And yeah, this is the project. Apart from that, you can save the courses and you can search the cases by the start date and date, the minimum number of sources. This is the second project if you all want to look at it. This project also shows that why the conflict exactly matters. It shows a high risk of internal bleeding and gives a new impression of gas rise of GERD. Apart from that, in the missing information, it shows why it is critical for determining appropriate interventions in case of cardiac arrest or rapid deteriorations. That is for the code status. And also gives you a question on what you can ask